Hello, my name is Lorraine. This is a video which was produced by the Institute of Medicine, Public Health Effectiveness of the FDA 510(k) clearance process. The meeting was held on June the 14th to the 15th, 2010. I want to show you part of the video where Lana Keeton at Truth in Medicine in the USA is speaking about her story.
Have enrolled or registered with the staff, and they will be called upon by
the placement of mesh for hernia repair. Despite
she should be speaking.
The next speaker is Lana Keeton from Truth in Medicine Incorporated.
Hello, my name is Lana Keeton. I am the president and I'm the founder of Truth in Medicine Incorporated. It is a patient advocacy organization. Based on the work of our organization, in particular that of Jim Schul and Bruce Rosenberg and myself and others, a public health notification warning of the serious risk and complications of the transvaginal placement of synthetic surgical mesh was issued in October of 2008 for synthetic mesh issued by 9 manufacturers. I have, I have met with Mr. Ulatowski and his team that's investigating synthetic surgical mesh at the FDA CDRH, and we have been interacting with the CDRH for 3 years now to issue a public health notification warning of the complications of the placement of mesh for hernia repair. Despite over 2,500 adverse event reports, that has not happened. I am here today despite my near death from the implantation of a medical device, synthetic surgical mesh, in December of 2001. I was in the hospital for almost 3 weeks, in bed for 3 months, and did not work for 6 months. I lost my health, my home, my business, and wound up in bankruptcy. I have been homeless and hungry in the last 8 years, and I live in chronic pain. I've been to over 20 doctors since 2001 trying to get well, and have had multiple mesh removal surgeries. In fact, I have another surgery next Tuesday. My bladder has become a cottage industry for doctors, hospitals, attorneys, and the court system, and by now probably has a value over $1 million. That cost has been paid by me, my health insurance carrier when I had health insurance, and the American taxpayer. This is in stark contrast to the original cost of the small piece of Prolene mesh, about $1,200. $1,200 to create it, and over $1 million to deal with the consequences is insane. Johnson & Johnson may have made $1,000 in profit, and myself and the American public are still paying for it 8 years later. Clearance of the Gynecare TVT Prolene mesh system, sold by Ethicon and its parent company, Johnson & Johnson, was a medical marketing decision. I was not included in the decision made by Gynecare, by Ethicon, and by Johnson & Johnson to put an unproven, unsafe, dangerous, petroleum-based, permanently placed medical device into the stream of commerce. The FDA cleared the device for sale through the 510(k). No patient should ever, ever, ever have to travel the journey I have traveled because of an unproven medical device. The 510(k) clearance process is the fox guarding the henhouse. It does not protect patients. The choice to make an informed decision of whether to take the risk of serious harm or death versus the benefits is not an option for patients. Medical marketing trumps patient safety. The FDA does not educate the public or even its own employees. Medical devices are cleared through a process not requiring proof of safety or efficacy for Class 1 or Class 2 devices. An uninformed, unaware public is daily endangered by unsafe, unproven medical devices. Please put patient safety first. Please stop the conspiracy of silence, leaving patients in the dark. I recommend you make the following changes to the 510(k) clearance process. Number one, really important, Educate the American public about the difference between pre-market approval and pre-market notification clearance process. Number 2, make patient labeling mandatory for all labeling devices. It is a regulatory authority available to the CDRH today. Number 3, make reporting mandatory with clear consequences for silence by doctors, hospitals, and medical device makers. Create a very specific guide for the FDA, CDRH to make better use of their regulatory authority. The decision-making process for when and how to use FDA's regulatory authority should not be left to the discretion of FDA, CDRH employees. Include a mechanism which stops medical device makers from paying doctors to misuse their legal authority to sell products off-label to increase the sales of their products. In closing, I am not the only one with a $1 million bladder. The 510K 974098 for the Gynecare TBT system alone, only one 510K, has astounding financial costs associated with it. Disabled patients who are no longer functioning members of society, broken families and relationships, millions of dollars in costs to the...
Your time's up, Ms. Keeton.
Thank you so much.
Okay, I will hold the video just there. I'm sorry about my speech problem, but I do suffer with another health issue. I hope that will give some sort of insight as to what the problem is currently going on all around the world. In my next part, I will put another video together, and hopefully it will bring even more light on the subject. You can visit Lana's website at Truth in Medicine, which I'll put up in my other video. I think I haven't prepared it here. Thank you for watching, and all comments are appreciated. Thank you. Goodbye.